housing. Can you speak about that very, very briefly?
Sure, and we're still working on that. We have been working with the permanent supportive housing contractors, and they have given us some estimates, and then we're doing our own analysis to understand exactly what we think those should be and how far our dollars can go. We're also trying to decide at this point, which of our housing portfolio fits that and how far it can go. So we have some housing that we share with, say, MoCD. We have some that we share with the Department of Public Health. We want to get a really good idea of how far the dollars go if we only focus on these legacy sites versus our whole portfolio. And so we still have a little bit of analysis to do before we get there. But we understand that there's some urgency to this for our providers, and we're working to get that as soon as we can.
I would just ask, I understand that we had this conversation prior, that you have the reserve accounts, that you need a little bit more time. But I think that coming up with a floor, even if that floor is raised, is better than waiting and saying, we'll get you those numbers September. So I would just ask that you work between now and next week before we finalize budget recommendations to come up with at least a pretty strong estimate so we can finalize that. Thanks. Thank you, Director. Thank you, Chair.
Thank you, Supervisor Chen.
Thank you, Chair Ronan. I would like to understand a little bit better about, is there additional street ambassador services in your proposed budget? And if there is, could you just clarify to me, is this like a new ambassador program, or is it like an increase of partnership with OSEA and expanded or is it expanded contracts with existing ambassador program?
So we have a couple different areas of the city where we've been working very closely with the community. And one of the things, as we've worked with them, they've felt very strongly that we need community ambassadors. One of those areas is in the area of 7-Eleven Post and kind of the surrounding areas. It's Lower Nob Hill. And as we've been meeting with the communities and realized that, there are many sites there that are operated by HSH. We have a NAV center. We have the new non-congregate shelter, 7-Eleven Post. We've got some hotels. We have agreed that we will provide community ambassador services there. And then also in the area of the 1000 block of Mission Street in Soma, we have also agreed with that community that we will provide some community ambassador services there. The one the one in Soma started a couple of days ago, started this week, and the one in Lower Nob Hill will be starting in July. And 5 Keys is going to be providing those services.
So it's not an OSEA community ambassador program. It's 5 Keys.
It's our own.
And it's also not the Urban Alchemy.
That's not Urban Alchemy. It's 5 Keys.
Got it. Thank you so much.
Thank you. Director McSpadden. So I'm trying to understand and reconcile the staffing investments, which is 60 new positions, and then the proposed staffing overview that only has, 29 new positions. Can you explain that?
Yes. So Director Whitley can answer that question.
Okay.
Good afternoon, Chair Ronan, members of the committee. I'm Gigi Whitley. I'm the Deputy Director for Admin and Finance for the department. And so you'll see in that high-level overview, really year over year, there's a net growth of 20 FTE. But most of there were about 36 temporary COVID positions in our budget last year. Those with the COVID response are not in our budget this year and winding down. But we're proposing, 50 positions this year that would be permanent. Year over year, you're seeing the net between the reduction in temp staffing and the increase in permanent staffing.
It's the permanent. Got it.
Yes, and I would just note of those new positions, 20 are for the new partnership with the managed healthcare plans called CalAIM to leverage Medi-Cal dollars. So that is a big part of the investment. Thank you.
Okay, that makes sense. And do you think you can hire all the vacancies that you have in the department this year?
Thank you for the question, Gigi Whitley again. So if you notice from our presentation, we did a record 94 new appointments this fiscal year, and that is really due to the hard work of not only our own HR team, but the support we received this year from 4 dedicated staff from DHR. We are proposing in this budget to make those staff permanent in our budget so that we can walk and chew gum, not just hire and manage testing, but also, retain employees, train our employees, make progress on our racial equity action plan as it pertains to the department. So we are very close with the 33 vacancies we have now and winding down this year's recruitment. The way we have sized the proposals before you in the new budget, not everything starts on day one. So some positions don't even start till January. There's a position that's going to start next fiscal year. It really tries to recognize a thoughtful hiring plan, but it does assume we're going to retain that team internally for HR positions.
And I just have one more question for
course.
Director McSpadden. I think, I was really excited to see, your department and the mayor's priority to end transgender homelessness. But we got a huge ad bag ask specifically for transgender housing. And we're told by the community that the plan in place will not get us to truly ending transgender homelessness, and this ask would actually get us there. And our list is so big I couldn't find the ask right now, but to give you more specifics. But can you comment on that and explain? Is that just like a lofty goal and this is going to get us some way, or is this a really measured plan to end it? And how should we be looking at this ad back ask?
Right. I think so we all share the same goal, and we've been working really closely with the Office of Transgender Initiatives, and they've been super helpful. I think, what the community is asking for is a shorter timeline than what we currently have, and we see this as a real investment over 2 years to bring down transgender homelessness, and we intend to come back with a further goal to continue that work over the next few years. But this is what we think we can do in the 2 years within our budget, and these are the dollars we were able to find to make that happen.
Okay, so this is to make a dent in transgender homelessness. What the community ask is that reasonable if we want to truly end transgender homelessness in 2 years?
Yeah, and I think I would say it's part of my vision that we completely end it or get to functional zero. And one of the things that we're going to be doing is building that, to really understand what that looks like for our department and to build that into our strategic plan. And I think that we're in the middle of that process right now, and we'll be working very closely with the community to identify what those longer term goals should be. But we are very, very much in alignment with that goal.
Thank you. And Supervisor Chip?
Thank you, Sharon. And sorry, just additional question. You have both the homeless outreach team, hot team, and then you also have now an encampment resolution team. Could you describe a little bit the difference between the two and the staffing level for both? Like how many FTEs for each? I'm just kind of curious the functions between the two, or like the difference, and then staffing level.
Thank you for the question, Supervisor. The Homeless Outreach Team, HOT, is staffed jointly by the department and our contracted provider, Haluna Health. And that is, I'm looking to Gigi to see if she might have staffing levels for these teams, but we have district-based teams in HOT who are out in the neighborhoods on a daily basis, conducting street outreach and linking people experiencing homelessness to services, to our coordinated entry system, which is the front door to accessing services. The encampment resolution team you can think of almost as a subset of the HOT team. It is also staffed by Haluna and by HSH, but is specifically focused on encampment resolution, as the name suggests, so that the ERT is working in very close partnership with HSOC, where they have targeted encampments that they are conducting outreach to and clearing and linking people to services depending on where the need is in a given week.
Great, thank you. So I'm just looking for the staffing number.
Staffing levels? Okay, we would have to get back to you with the staffing levels.
Thank you.
Thank you. Thank you very much. That's all the questions. If you could present on item number 5, if you'll remember.